Welcome back to Normalized PTSD. Today we're going to discuss what is PTSD. Kind of feel like we should have led with this one, but I hope it's informative. And I was able to get in contact with a Dr. Norman, and she's going to discuss with us from a clinical standpoint what is PTSD, as well as what is the most, well-known and effective treatments for it currently. And we'll just do a quick summary on those two, and hopefully later down the road I'm able to get her or other doctors to come back on to discuss those a little bit more in depth also. So here we go. Hope you guys learned something new. Thank you so much for joining.
Sure, my pleasure. Thank you so much for having me. So, I am a psychologist and I have worked for many years both treating patients and as a professor doing research in treating PTSD, and also do a lot to try to educate other clinicians and the public on how we treat PTSD.
Awesome. So PTSD, what is that, and how does that happen? You see you experience a traumatic situation and then you end up with PTSD. And are there different types of PTSD?
Sure. So yeah, that's the right starting point. So to develop PTSD, someone has to go through a life-threatening traumatic event. That's different from something like depression or anxiety, where it can just kind of develop more out of the blue or slowly over time. Someone can have all the sort of predisposition to have PTSD, but if they don't experience a traumatic event, they can't develop it. And when we say traumatic event for PTSD, we're really talking about a life-threatening traumatic event. So something like combat or being assaulted or being in a natural disaster or mass violence event. So if I were just chatting with you, Jonathan, I might say like, oh, I got fired or I broke up with someone and it was so traumatic. And that would be totally correct because we're just chatting. But if we're talking about diagnosing PTSD, that trauma actually has to be this life-threatening event. So if someone experiences a life-threatening event, most people right after have a really hard time, understandably, right? Maybe it impacts their sleep, their ability to concentrate, they're jumpy, they can't stop thinking about it, they have nightmares. That's very, very common right after a trauma. And for most people, that gets better over the next few weeks and months. But for people who kind of stay that upset, continue to have those symptoms, and those symptoms are severe, and those symptoms are impacting the rest of their life, that's someone who might have PTSD.
Is there anything that may contribute to one not having extended symptoms and maybe not be ever being diagnosed with PTSD, and the other group that does have PTSD?
Yeah, that's kind of the $1 million question. We're doing a lot of work to try to understand who's at risk for PTSD, because more than half of us in our lifetime will have a traumatic event, but only about 6% of the population will go on to develop PTSD. And that number is not much higher among veterans. Sometimes people assume like, oh, but in veterans, it's so much higher. In fact, large population-based studies show that it's still 6 point something, like under 7% around veterans too in their lifetime will have PTSD. Where it's different is veterans who come to VA for care, the rates there can be a bit higher, like in the teens. So the question you asked is who is likely to develop PTSD? There's no clear formula for that, but we do know there's some risk factors that make it more likely someone may. So some of those are about the person. So if someone has had prior trauma or already has anxiety, depression, or other mental health problems when they have their trauma, they might be more likely to develop PTSD. We know from really large epidemiology studies that women and people of color are more likely to develop PTSD than men or people who are white. This doesn't mean anything. Like when someone comes into my office, I don't say, oh, you're a woman of, this racial background, you must have PTSD.
Mm-hmm.
It's not like that at all. Like, these are small kind of statistical increases we see over thousands of people. It doesn't mean anything for any particular person, but that's kind of what we're seeing. We don't yet have a PTSD gene, so we don't know that if someone has this gene, they're going to develop PTSD. But there are some genetic risk factors just for developing mental health problems in general, so we're still trying to learn more about that. Another thing is about the trauma
Hmm.
itself. If the trauma is caused by another human, like an assault or combat kind of situation, then someone's more likely to develop PTSD than if they live through like a fire or an earthquake. It seems like there's something about how could another human cause this kind of pain and suffering that sort of is hard for us to make sense of and contributes to potentially getting PTSD. Repeated exposure, so years of abuse, a long drawn out, combat situation is more risky than a one-time kind of traumatic event. And then also what happens after the trauma. So if someone's in a supportive environment where they can really heal, they're less likely to develop PTSD than if they're in an environment that's very stressful, where they feel very unsupported, where they maybe go on to experience more trauma. Those people who have that more stressful environment are more at risk. So those are some things we know. But again, when someone comes into my office, I just need to find out what's going on with them and not assume based on these other characteristics that they do or don't have PTSD.
Right. What are some symptoms that may be pretty obvious if dealing with PTSD?
Yeah, so there's four categories of symptoms, and to get the diagnosis, someone has to have one or two of each at least, and they could have a lot more. But one category is that they get reminded of the trauma, even if they don't want to be, and then they get upset. So that might be in the form of nightmares. They're dreaming about the trauma. It might be in the form of it just pops into their mind, and then they're like, they can't stop thinking about it. They're upset. Their body's reacting. They might have flashbacks where they actually really think they're back in the traumatic event, even though they're here now and safe. Another group of symptoms is avoidance. So even though people are being reminded of the trauma when they don't want to be, they're working very hard to avoid remembering that traumatic memory. They don't want to think about it. They go to great lengths not to think about it. They might also be avoiding people, places, things that remind them of the trauma. This is one of the ways that PTSD can really limit someone's life, because if you stop going into crowds, you're no longer going to those football games you used to enjoy. You're no
Right.
longer shopping when you used to shop, and your life kind of becomes more limited. Another group of symptoms is you change how you see the world and how you feel. So people feel more guilt, more anger, more shame. They may be they may have a hard time feeling any joy or pleasure in life. They don't want to do things they used to do. They've changed how they look at the world. So now the world feels much more dangerous. They feel much worse about themselves than they used to. And the final group of symptoms are in that arousal category, where it's like they're always on. They can't settle, they can't rest. They're always scanning the environment. They're easily startled, jumpy if they hear an unexpected noise or something. They have trouble concentrating, trouble sleeping because they just can't go into rest mode. So that's another group of symptoms.
What are some typical coping mechanisms that people may be doing to, I guess, instead of getting therapy, might lean to get help with symptoms?
Yeah, we do think of it as, there's ways to kind of cope and manage the symptoms. And then there's treatment, and we do have recovery oriented treatments where it's kind of the goal is really to recover, not just to sort of live with the symptoms and manage them. So I'm glad I know you're planning to ask me about both, and I'm glad we're going to talk about both. Coping can be positive or negative. So positive coping might be relaxation strategies, breathing exercises, meditation. It might be reaching out to supportive people and doing something with a friend or a family member. It might be having a list of things you enjoy doing or things that calm you down, and pulling that out when you're having a hard time. There's an app called the PTSD Coach. And there's also a website version called PTSD Coach Online. And it has a whole bunch of these kinds of coping skills. So if someone can't think of something, but they feel, this would be a good time to help me manage my symptoms, they can open up this app, which is free, and they can, scroll through the app, kind of think of like Tinder, but instead of finding a date, you're finding a strategy to help you manage your symptoms. And you could be like, nope, not this one, and go past it and be like, yeah, no, I want to try this. And then the app will walk you through, that breathing exercise or whatever the strategy might be. Highly recommend the app. Um, So that's positive coping. Unfortunately, sometimes people use coping that we call negative coping, which is where it might help in the moment, but might lead to more problems down the road. So that might be something like drinking, right? Well, I'm going to
Right.
drink to help me fall asleep. I'm going to drink to help me go into that social situation that my husband or wife is making me go into, and I don't want to because of my PTSD. Maybe it helps you that night fall asleep. It helps you that night get through that dinner party you don't want to go to. But then, of course, it can lead to addiction. It can lead to more and more use. It could lead to, physical health problems. Isolating is another potentially negative problem. Sometimes it's good to spend some time by yourself, but if someone always goes to wanting to be alone, shutting out other people, that can cause some problems in the long run. Um, so those are a couple of examples of negative coping. Um, yeah, so that's some coping info.
So I see a lot of individuals who may be experiencing some symptoms related to PTSD that, they're not really self-aware of it. And, if you ask them, they're fine. But it's like, it reminds me of one of those memes where the guy's on fire and he's walking, he's like, everything's fine.
Mhm.
So for someone who wants to do like a self-evaluation of their situation, be like, hey, maybe I do have a problem. What are some things that they may see that this is impacting their personal life in a negative way?
Yeah, that's a great question. So we have on the National Center for PTSD website, there's a really brief, we call it a screening measure. It's basically like 6 questions that you say yes or no to. And if you say yes to, I think it's either more than 3 or more than 4 of them, it'll tell you on the website. It'll say, this isn't a diagnosis, but maybe you have PTSD. And people can take that and talk to their doctor, talk to their mental health provider if they have one, any healthcare provider, really. They can, it's a good entry point, and then that person can help them, really do assess if they have PTSD. But they can find that at ptsd.va.gov/screen. 6 questions, yes or no questions. I mean, under a minute, and it can again give them some idea. And it can be really helpful to take the screen, because sometimes people just they're having all these problems and they think they're unrelated. They're like, oh, and now I can't sleep and I can't concentrate and I'm always jumpy and I can't stop thinking about this trauma. But they just think they're having all these problems. And then when they realize, oh, wait, this is all under this umbrella of PTSD, and PTSD is treatable, it can really take some load off. So it's helpful to figure out if it might be PTSD. Other ways that people can figure out if they have PTSD, just go to that National Center for PTSD website, and there's so much to read about. There's a lot of very kind of understandable materials in English, also in Spanish, to get the basics of what is PTSD. So that can be helpful. Another good resource is About Face. So someone can Google About Face PTSD and it'll come right up. And it's videos of veterans from all service eras, all ages, all kinds of backgrounds, identities, talking about how they discovered they had PTSD, what life was like before treatment, how they finally decided to get treatment, what that was like, what life is like now. You can watch a longer continuous video. You can watch just little short segments of each of those questions, like how I knew I had PTSD. So someone can find someone that they can relate to and hear their story. And that could also help them figure out, like, oh, yeah, this is similar to what I'm going through. Or, oh, no, my experience is very, very different.
It's a really awesome place to start, hopefully. And that's a good segue into what are some effective treatments for PTSD? Because it seems like there's so many out there. And that's kind of what we wanted to do, is get together and just put a list together, be like, here's some ideas.
Yeah, it can be really hard as a consumer to figure out what treatment to get, because there are so many out there. And, there's a lot of promises of cures. I would, if someone says my treatment will cure your PTSD, that's a little bit of a red flag. What our treatments can do is really help someone recover. And what I mean by that is you can kind of live the life you want to live, right? Like often PTSD interferes with how someone's ability to meet their goals at work or in their career or in their education. makes their relationships really hard, whether it's romantic relationships or parenting or even friends, other family. And so when I say recover, it means you might still have some symptoms, but they don't interfere as much with living the life you want to live, feeling joy, having the career you want, having a healthy relationship. So that's when I'm talking about recovery, that's what I'm talking about. But someone will still have had trauma, and someone will still be impacted by that, and they'll still have pain from that memory, right? That won't go away. We can't erase that. So in terms of effective treatments, there's a couple of categories of treatments that are the most effective, that have been very extensively studied with veterans, studied across many different studies, both by the people who developed them and people who had nothing to do with developing them, so really had no horse in the race to prove that they were effective treatments. Those are really important things to look for. And the categories of treatments that work well, probably the most effective is trauma-focused therapies. And I'll spend a lot of time on that to break that down. But those are psychotherapies where someone does process their traumatic event over the course of the therapy. Maybe they process that memory, they process the emotions, the hurt, the way they think about it now, and that helps them move forward in their life. There's also certain specific therapies that are not trauma focused that work. They're not, the number of people who recover and just how much their symptoms go down may be a little bit smaller than the trauma focused therapies, or somewhat smaller, but they still help people. And then there's also specific medications that can help treat PTSD. So should I just go ahead and kind of go through each one of these a little bit?
Yes, ma'am. That'd be awesome.
Okay, happy to do it. So the trauma focus, these are usually about 12 sessions. Some are shorter, some are longer, but someone can expect to be in treatment maybe for about 3 to 4 months, once a week, maybe shorter if you come in more than once a week, and hopefully feel much better by the end of it. And some of the three most common ones that we hear the most are cognitive processing therapy, prolonged exposure therapy, and EMDR, which is eye movement desensitization and reprocessing. All of these are trauma focused. So people talk about the trauma in various ways or process the trauma in various ways throughout, but in very different ways across the three therapies. In cognitive processing therapy, people really look at sort of how their view of themselves and the world became more extreme and kind of not as healthy through the trauma. It's very common for someone to come out and be like, the world is so dangerous. I didn't know this before the trauma, but now I realize I'm never safe. Or I realize I can't keep my family safe, or I'm not competent to do this. These very extreme thoughts. And so through the therapy, they work through those thoughts, come back to a more balanced place, and that helps them recover from those other symptoms of PTSD too. In prolonged exposure therapy, the idea is that people who develop PTSD, they're having a harder time thinking about the traumatic event. They haven't processed the memory as much. They have all that avoidance that everyone with PTSD has, and the therapy really tackles that head on. Prolonged exposure therapy, they actually talk about the memory of their trauma, and listen to recordings of that memory so that it loses some of that power over them and becomes more of a memory, a very negative memory, a very hard memory, but a memory nonetheless that's in their past, and they can move forward. And similarly, they start doing some of those things they've been avoiding because it triggers symptoms of PTSD. It feels too dangerous, so that they can see, oh, wait, I've been avoiding that because of my PTSD. But even though I was in this explosion and the smell of gas is now very triggering to me, it's actually pretty safe in my town to go fill my car with gas, or it's okay to go to, a busy box store during the day, or I can go to that football game and it's actually safe. So we give them those opportunities to actually experience their body, their brain, all throughout, that these things are safe. So that's prolonged exposure. And then EMDR is a little bit different, where people actually think about that traumatic memory rather than talking about it. And they do so while they follow something with their eyes or have a repetitive tapping motion. The theory is that engages sort of different parts of the brain and helps them process that memory. And they do this process until the memory doesn't have this emotional power over them anymore. So those are 3 different ways. There's some other trauma-focused therapies too that are still, they've been studied, but not quite as extensively as these. But these, more than half the people who do these lose their diagnosis completely. And a lot of more than that have a very meaningful drop in symptoms and feel much better at the end.
Okay. So it sounds like it helps them desensitize that event as well as learn how to cope with the emotions of that. So,
Yeah. And in such a time limited way, right? Like, again, and like someone could be suffering for years. I mean, not in the last few years, but not that long ago, I was still seeing World War II veterans who'd had their trauma since World War II, and they felt so much better at the end of the therapy in the course of about 3 months. I mean, to think of all those years of suffering and that, in a time limited way, they can feel much better. It's pretty amazing. The non-trauma focused therapies are ones that do focus more on coping and problem solving and strategies to just help you feel better today without going through so much the memory of the trauma. So for someone who really, really doesn't want to do the trauma work, they can do one of those therapies and their symptoms can absolutely improve too. Those are also effective. Again, that just in the studies, we see that the effect sizes, meaning how many people get better and how much better they get, can be a little bit smaller, but they're still effective.
there's other things out there that people can do. We're just hitting on the most effective, like the ones that have been studied. There's a lot of research to support that. If you go to therapy, these are like the starting points because they're going to start with the best chance to give you help.
That's exactly right. That's my view of it, right? Like, I know that when someone shows up in my office, if a veteran comes in, they've had PTSD for a number of years, it's their first time in treatment, or maybe they tried it before and it didn't work or didn't work enough. Like, they had to gather up a lot to come in. And I feel really honored that they're giving the treatment process the chance, that they're giving me the chance to help them. And so I start with a conversation about, let's talk about what we know about different kinds of treatments. And then, I do kind of encourage them trying one of these trauma focused ones because it's taken them so much to come to me. I want to respect their time. I want to respect what it took them to come in and offer them the best there is. And so, and make the most of the time. And I don't want them to have, it can be so demoralizing to have a treatment experience that doesn't work, right? Like,
Yes.
part of PTSD is struggling with hope and feeling hopeful. And so if someone has an experience where they're like, no, I did treatment and I just felt the same, or I felt worse, like that's no good. It's going to be even harder for them to come in and try it again. Why bother, right? So I
Right.
just really want to take advantage of them giving me this chance, giving treatment this chance, and say, let's try the thing that is most likely to help you feel better.
Okay. So if trauma focused treatment seems a bit too intimidating, what would you recommend for that individual?
Well, I wouldn't suggest they rule it out. I'd suggest they talk about their concerns with their mental health provider and kind of leave it on the table. But there are these therapies that are more present focused. We call them one is present centered therapy. That's one they can ask for that can work pretty well. That's probably the one with the most evidence. So I would look for that. There's some kind of more mindfulness-based therapies that are being studied that we don't know as much about yet, but that could be an option as well. And then there's medication. And so the medications that tend to work well for PTSD are similar to the medications we use to treat depression. So like a category of medication of SSRIs or SNRIs. So some of those are like sertraline, venlafaxine, a couple of others. But, I wouldn't, sometimes people want to jump to like an antipsychotic medication. I wouldn't recommend that as a first step. Sometimes people want to take something we call benzodiazepines. So that's like Valium and some Klonopin, similar drugs. Those can be pretty addictive and aren't actually shown to work well with PTSD. So I would really try to avoid those.
Right.
And I would stick with those depression medications, which have been shown to work well for PTSD.
Okay. That was one of the questions I was going to ask. What are some pros and cons to medication? Because I feel like there's a lot on both sides.
Yeah, it's a really personal decision. And I would say the people I see are really all over the board in terms of having a preference for medication or therapy, or just wanting to, kind of throw everything at it, at their PTSD and try both at the same time.
Mhm.
There, based on the evidence, there really isn't a wrong door. Um, so I think it is a personal decision. We have something, there's a resource on the National Center for PTSD website called the PTSD Treatment Decision Aid. But it's a very interactive site where someone goes in, they don't put in any information or anything about themselves. It's really just for them to play around with the site and figure things out. But they can learn more about the therapies, trauma focused, not trauma focused. They can learn more about medication. And then part of what the site they can do on the site is actually go through a series of questions like, can you come in every week? Can you do some homework between sessions? Are you willing to talk about your trauma? And based on their answers to those questions, they can see like, oh, maybe medication is best for me because I can only come in once a month, or maybe this kind of therapy would work really well for me because it seems like I'm open. I want to talk about my trauma. I want to do, so this kind of treatment might be best. So it's a good way to explore the different treatment options, and then also start thinking about, okay, what might be the best choice for me? And that helps them go into talk to their doctor or their mental health provider with a lot of information, like have a really well-informed discussion.
So it sounds like medication is, I don't know, helps you deal with some of the symptoms that you may be experiencing, but or maybe even create a window of opportunity where you don't have that really close emotional connection to all the trauma so that you can maybe work to get help and then kind of use them together. I don't.
Yeah, I think that's a good theory. I think with medication, we don't know exactly what the mechanism is, but we know that people feel better, and that feeling better could stick even after they stop taking the medication. So yeah, I think that that's a really good point. And it's right for some, not right for others. There can be side effects. Sometimes those are just in the beginning and they pass. Sometimes they stick. So that's some things that people sometimes consider when that's deciding whether they want medication or not.
And I will save a deep dive into medication for a later date. And with that, I'll just give you an opportunity. Is there anything you would like to summarize on PTSD before we wrap this up?
Yeah, a couple of things. One is I just really want to leave your listeners with a message of hope for those people who are listening who maybe feel like PTSD is a life sentence, or it's kind of like, diabetes, like they have it for life and they have to manage it. Things have changed. We do have these treatments that are pretty effective. It's really worth a shot. There is hope. So contact your VA. If you get treatment in the community, contact a community provider. Um, the VA does make these treatments very widely available in the community. You have to ask to make sure you get these. And I would really encourage folks to look for these evidence-based or, effective treatments, we call them, that have been shown to work. Because again, if you look at like different resources online, you can find 8,000 different things that say they will treat
Hmm.
PTSD. They may or may not. Most of them have no data behind them, so they just don't know. We just don't know. So again, I encourage your listeners to try the thing that works. And then if it doesn't work for you, then go on and try these more experimental, newer things. But if you're going to give treatment a shot, why not try the best thing out there first?
I feel like the war really sparked interest in mental health at a really fast pace. So these are really, really good ones to start with. But I imagine in the next 5 years, that list is going to be longer. There's going to be things added to it. There's things in the works.
There's so much research happening. It's a really exciting time. And yeah, in the 5 years, we absolutely may have a broader menu of treatments that we know work really well. But right now, there's a lot of things that are being studied, and we don't know yet how effective they are. And there's things that are being sort of thrown out there that
Mhm.
haven't been studied at all. So definitely something to watch out for.
Absolutely. And with that, we'll wrap it up. Thank you so much, Dr. Norman.
Thank you so much for having me, Jonathan. It's been a pleasure.
And we're going to wrap things up. Hopefully, you have a little bit more information now than you did before. And my goal is to do this with just about every type of therapeutic that I can find, as well as, some experimental stuff that may be out there. So stay tuned for more.